I do a lot of hernia surgeries, inguinal hernia and abdominal hernia surgeries. I talk a lot with hernia patients, for example, of the potential complications, the potential for chronic pain and scar tissue. And sometimes if the hernia isn't bothering you enough, or if the problem isn't severe enough, it's not worth going through surgery. Often with a hernia, a patient is worried about something different than I am. Patients will often come in complaining of the bulge or pain from a hernia. And while I want to help with those, my main concern with hernias is the safety, because hernia can lead to a bowel obstruction or bowel ischemia. And so I'm trying to fix hernias before it becomes an emergency surgery for that patient. Also, I can repair the hole that the hernia represents, but I can't undo the damage that the hernia has caused to the tissue around it. So most of those patients will still have a small bulge. This is not a cosmetic surgery that I do. It's a functional surgery to put the muscle back where it's supposed to be and prevent a complication down the road. So patients may be surprised that they have a scar that's bigger than the hernia was, or that they still have a bulge there even though the hernia is gone. The tissue is still stretched and is never going to be completely normal again. Patients will often find that they have a hernia either because their primary care doctor sees a bulge or because they're having a bulge or pain that they've noticed. Hernias don't automatically have to be repaired just because they're there. We usually tend to wait to fix a hernia till it's causing pain or discomfort on a daily basis, or is significantly interfering with your ability to work or do the activities that you want to. Once a hernia is severe enough to be repaired, then we can have a conversation about whether to fix it with mesh or without mesh, whether we do it open or laparoscopic. The goal with a hernia surgery is to restore the functional anatomy. So putting the muscle back where it's supposed to be, closing that hole so that you're able to lift and work and do leisure activities without any pain or discomfort or limitation. One of the most common questions, most common decisions we have to make for hernia surgery is how to repair it. There's two big decisions. One is whether it's repaired laparoscopically or open. This applies to inguinal hernias or abdominal hernias. Laparoscopic surgery is where you work from the inside with lights and a camera, and open surgery is a large open incision. And usually both of those options are good repairs. It's a question of the size of the scar and what options have been used before if this is a recurrent hernia. The other big question is whether the hernia should be repaired with mesh or without mesh. A lot of hernias can be repaired with just sutures, where you just sew the hole shut. But a lot of hernias have to be repaired with mesh. The reason is if you try to close a larger hernia with just sutures, there's a very high risk of that hernia coming back. A lot of patients are concerned about mesh because it's an artificial plastic item being left in their body forever. And in some situations that can cause problems. We see those problems more with other surgeries around the bladder or intestine because of that mesh's ability to irritate surrounding structures. For hernias, we've been using lightweight polypropylene mesh for decades, and the risks are present but very minimal and well understood. The risk of the hernia coming back is much higher than the risk of the mesh causing problems. The other problem is that a lot of the complications or a lot of the issues that patients have after hernia repair are due to the scar tissue and the actual surgery. Whether you repair the hernia with mesh or with stitches, there's the potential for scar tissue, chronic pain, reoccurrences. So I'm more concerned with doing an excellent repair that has a low likelihood of coming back. And I think for a lot of patients, mesh is the right answer for that. But when it's possible to, I certainly try to avoid using that mesh.